Good afternoon, good people. All right, I'm delighted to be here. I'm from San Diego. I'm Dana Richardson. I represent Community Health Improvement Partners. Thank you for having me. We work to address, to improve the health of all San Diegans through collaboration, needs assessment, and advocacy. And so I'm going to give to you two presentations. This will provide you a national perspective of the nexus between safety and violence prevention and chronic disease prevention and the epidemic of obesity. But I'm going to start with a general question. All right. Do you believe that violence in your communities is a barrier to healthy food access and physical activity opportunities? I see a lot of heads nodding, right? Right. So I know that you're elected officials and dignitaries, but I want you to think about the story that I'm going to tell you and just you as a citizen living in your own neighborhood. So let's try to take it just kind of a step down. So I want to tell you a story. And my grandmother lived in Norfolk, Virginia, and from like the age of 6 to 11, I spent every summer in my grandmother's neighborhood. It's called Huntersville in Norfolk, Virginia. And I loved being there with my cousins, my aunties, my uncles were, my heroes. In any case, it was a lovely experience, but it was a tough neighborhood. And I'm coming from California. And so the kids, they steal my toys. When I come out, they be waiting for me. And quite frankly, I wanted to stay indoors. The experience was wonderful, but it was also hard. There were two things I hated. I hated going outside because I would always have these two brothers, Rufus and Man, waiting for me at the block. And all I wanted to do was go to the Boys and Girls Club and play some pool or go swimming. The other thing that I didn't like was the girls on the block actually challenged me to race, and I wasn't fast. And when I lost, there went my dignity. So I just give you that perspective in talking about this safety and violence prevention because, I got the respect of my friends in the neighborhood. It took about a month. I took some lumps, and I gave some lumps, right? And then by the second month, everybody was good. So the reality of violence is really a justification for people not wanting to go outside and walk to places that they normally would. Violence, blocks are separated by turf. And when you see signs like this, you know where you're at. And in some cases, you might not want to go from Huntersville to Park Place. And then we know that violence impacts community investment. Businesses want their employees to feel safe, and they want their patrons to feel safe. So maybe they might not want to locate their business in that community. And so I'm doing this presentation on behalf of my colleague, Virginia Lee from Prevention Institute in Oakland. And Kaiser Permanente gave them some money to commission this report addressing the intersection, preventing violence and promoting healthy eating, active living. And basically they were able to talk to a bunch of community leaders like yourselves, me, and it validated what we already intuitively know. Safety is a problem. Safety is related to obesity. If you do not address safety, you can't hit on the chronic disease outcomes. You cannot turn the tide on this obesity epidemic. It's so real. So let me just run through the key linkages. So violence and fear of violence causes people to spend less time outdoors. It alters people's purchasing patterns. Experiencing and witnessing violence is traumatic, and it decreases your motivation to go outside and eat healthy. It also reduces social interactions in your communities and social cohesion opportunities, and it also impacts access to healthy food and community resources and investments. So the intersection is very real. Outside of the work, the Prevention Institute and the National Convergence Partnership, they made it so that for my project in Chula Vista and 5 others around the nation, had to have young people at the table, had to have an obesity prevention provider at the table, a violence prevention provider at the table, and the public health department. If you didn't have those partnerships, you could not get the grant. And so what we need to do in our underserved, low-income communities is take it from risk factor to resilience, from the prevalence of risk to hope and opportunity and equity for community. Communities of opportunity look kind of like what I saw in Paul's presentation, with parks, with sidewalks, with grocery stores, financial institutions, better performing schools, decent and efficient transportation options. But in low-income communities, we literally see fast food, liquor, unsafe parks, limited park space, and we have limited transportation options. So this work is proven and it's focused. I could attest to that through my own experience, and learning about this violence prevention perspective has really helped to improve the efficacy of the work, to create safe places, to promote community development, employment opportunities, and to foster social cohesion in communities. And so we know this work is effective. And so in the Bushmaster neighborhood in Flagstaff, Arizona, they did the walking school bus. Paul talked about that. But around this park, they also have this No Sales 40 initiatives where you can't sell next to the park location, and that has reduced crime. In Philadelphia, they have a mural arts program, have put up 2,500 murals citywide since the mid-1980s. It's a project that engages youth and engages community residents in mural design. And the research suggests that public art increases the sense of well-being in the community and social connectedness. And in South Central Los Angeles, they have the Community Coalition, which has shut down 200 liquor stores in 3 years, and average crime, 27% reduction in crime within a 4-block radius of each liquor store that was closed. So the National Convergence Partnership, where I work in Chula Vista, is one of 6 pilot programs. And this is kind of what we're working on. The risk factors in the community: poverty, economic despair, alcohol and drug use, community deterioration. And then we're combating that by looking at economic capital, good physical, mental health, artistic and creative opportunities, meaningful opportunities for community participation. And so my colleagues in Oakland are doing Safe Routes to School. My colleagues in Louisville, Kentucky are looking at improving lighting in some areas of the community and reducing alcohol and tobacco advertising. My colleagues in Detroit have a community bus system that will take members of the community to the grocery store and other essential destinations. And my colleagues in Huntington Park, they have a park where they have a farmer's market, a community garden, and the young people that live in the area are attempting to be the best park stewards. And then my colleagues in Denver are also preventing violence through urban farming. And when I'm able to do the breakout, I can't wait to tell you our story. So this is a national perspective of the issue, just to give you a flavor of what's happening. And I'll be able to share with you the in-depth Chula Vista story at the next breakout. Thank you for your time.